class, my name is Holly Trevino, and for my final project, the disease that I have decided to discuss is breast cancer, specifically during the 20th century. Let's get started. So, one of the first things we're going to discuss is how breast cancer was understood during the 20th century. From a general perspective, the disease itself was understood by the medical community at that time to be either a localized or systemic disease, meaning that the cancer is either limited to a certain part of the body, usually the breast tissue, or has spread to a different part of the body from where it began. Much of the understanding of this disease relied heavily on descriptive understanding based off of clinical trials and data that came from those trials. When considering the general consensus of what was understood to be the cause of breast cancer, it was mainly understood to be caused by genetic abnormalities or mutations. This was mainly influenced by the introduction of molecular biology, in which researchers were now able to get a more thorough understanding of cancerous cells and the human genome itself. Despite these significant advancements in the understanding of breast cancer in comparison to its historical understanding, breast cancer was still poorly understood with much debate surrounding its treatment and cause. Prior to the 20th century, beliefs concerning the cause of breast cancer and its understanding varied greatly. There were several ideas that were thought to be the cause of this disease, such as it being an infectious disease, an imbalance of the humors, accumulation of black bile, and it was even attributed to be a byproduct of old age. Most of the defined causes of this disease and its understanding were heavily influenced by the societal beliefs at the time and the medical practices of the respective era. In sum, the understanding of this disease and its defined cause has greatly changed throughout time to mirror the medical practices of its respective era. When considering the various eras and ideologies surrounding the definition of breast cancer and its symptoms, it is clear that there has been much change in defining the disease, with some change in defining its symptoms. Historically, breast cancer was defined to be incurable, the result of the cessation of menstruation in old age, an imbalance of the humors, specifically black bile, as a result of religious punishment, a result of the imbalance of the lymphatic system, and it was even attributed to be as a result of inspissated milk, trauma, personality type, exposure to air, and infection. Definitions in the way that breast cancer was defined drastically changed during the 20th century. It was defined to be as a result of genetic abnormalities that lead to the replication of cancer cells, which can be either localized in the body or systemic. Another important change that occurred in the way that breast cancer was defined was that it went from being previously deemed incurable to treatable. The symptoms of this disease have remained relatively the same throughout time, with the main symptoms being the physical display of the disease on the breast, so the abnormal mass that is usually found, discharge from nipples other than milk, this is usually blood, swelling, irritation, pain in the breasts, and death. The next thing we'll discuss is the changes of treatment over time. The 20th century treatment plan mainly focused on a multimodal type of therapy, which integrated surgery, chemotherapy, and hormonal therapy to treat the disease. Prior to this time in history, breast cancer and its treatments significantly varied from era to era, which wavered between unnecessary mutilation, such as through mastectomies, or inadequate treatment, such as through bloodletting of the breasts, or through the use of ligatures or lead plates to strangulate the tumors. When comparing both treatment plans of the 20th century and to the treatment plans prior to the 20th century, the 20th century takes a more conservative approach with the goal of preserving the breast tissue. Breast cancer in society. Throughout history, the female breast has always been a symbol of beauty, fertility, and femininity, with breast cancer challenging physicians since the early eras of time. The societal perceptions of breast cancer prior to the 20th century was mainly viewed as incurable, as a religious consequence, and it did not have the public support it would soon have in the 20th century. It was also considered to many a death sentence. The societal perceptions of breast cancer during the 20th century drastically changed in that the disease was viewed to be as one of the most significant health threats facing women, with much public awareness and involvement, philanthropic support, and increased governmental awareness and funding of research. The image I've decided to share is an interesting painting from the Renaissance period, in which the sculptor Michelangelo depicts the proposed diagnosis of a tumor in the left breast of the woman pictured here. If you look closely, the painting shows the presence of a large bulge medial to the nipple, an irritated area surrounding the nipple, almost complete nipple retraction, and a consistent reduction of the entire left breast itself. I find this image interesting in that it provides an accurate reflection of the physical symptoms of breast cancer. I hope you all enjoyed this lecture. It's been a great class. Thank you for your time.